Hello guys, I just got back from my consultation. Um, Excuse my appearance, I got up at 7 and I feel like I look like booty, so ignore it. Um, Everything went great actually. I was really nervous because I thought the doctor was going to be an asshole. I thought the nurses and everybody there was going to be an asshole because I'm transgender, and I just assume everybody's going to be mean to me because I'm transgender or something. Like they were going to look down upon me, but they didn't. They were actually really nice. I found out I'm his second transgender um, patient. He said that since he does a female breast augmentation, he wanted to try transgender breast augmentation because it's basically the same thing. So that was really awesome to know. Um, he told me everything that he thought that I should do. He also wanted to make sure that I was okay with it. He wanted to, um, you know, make sure that my anxiety and stuff will be okay. And like he said, that everything's going to be okay. It's like a routine thing. He's done it a lot. Um, so that's good. Um, so what he wanted to do is basically, I'll tell you what happened. So when you go in, they talk to you, and then he tells you to get a robe on, and then he comes in and he has to look at your boobs. He has to do a breast examination. He was supposed to measure them, but he didn't have his thing. He said he's going to do it before my surgery, like post-op, pre-op, post-op. I don't remember what he said. He said something like that. He's going to do it before my surgery. Um, he he did a breast tissue. He did a breast exam, which I never let anybody touch my tits, like under my shirt. You know what I mean? And it was really nerve wracking. And then he had to take off my shirt and take pictures. That was nerve wracking also because, like I said, I never take my shirt off, only to shower. And of course to get changed and stuff. So that was nerve wracking. So if you're going to be going into like a consultation for breast surgery, just keep an eye out for that. Just brace yourself because I know some people are really self conscious, and I'm very self conscious about my chest. So what he said was normally, like, female breasts have like a curve at the bottom, like when he has to do the surgery, like they're kind of like curved. Mine are not. Mine are kind of like just a bump. And he said that it's not going to do, he won't be able to do the normal boob thing where it's like a curve at the bottom, like a normal breast augmentation. It'll look a little different. It'll just be fuller up here, not so much like super full down here. Um, he also said my nipples are kind of not asymmetrical. One of them's like a little slightly up here, and one of them's like slightly not even, you know. He said he's not going to change the placement of them. He's just going to put an implant in there. And as for the size, he asked me what size I wanted to go, and I told him I wanted to go sorry, I don't know why I breathed in like that, a size big B cup or a small C. And he said that's perfect. That's normally how much, like how big he normally goes. And he said that I'm a great candidate for that size because the hormone replacement therapy has done a lot and given me a lot of breast tissue um, to work with. He also just said that he wanted to wait to see how much my chest can take, how many cc's. He said he could do like 100 something cc's, or I don't know what he said. He was really close to my face when he was talking about my boobs, and when people are really close to my face, I don't listen. I panic. Um, so he told me everything afterwards. He drew it out. He told me what he will do. Um, he said, and then after all of that was done, he said he's going to send everything to my insurance company. And he said that it should be covered like right away. Because with my medical, they don't give you like a confirmation normally. They just say, just do the surgery. And he wants to talk to my psychiatrist first, for a couple hours, or I don't know how long he wants to talk to her because she knows me more, I guess. Um, so yeah, he said his people are going to contact me. Um, he said in a couple weeks to make the appointment for the surgery once I'm approved, and they're going to do it in Seattle. So awesome. I am so excited. I cannot wait. I'm so happy he's a nice doctor because I was really, 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 really scared that he was going to be an asshole. I just assume every like attractive guy, no offense to attractive guys out there, but I just assume every attractive guy is going to be an asshole. Um, and I need to stop doing that. But it's a thing. I don't know why. But he was really nice. So that's awesome. I can't wait. And once the surgery appointment is made, I will make another video talking about that. Hopefully he'll call me sooner than a couple weeks, but I'm sure it's going to take a couple weeks for my insurance to cover it. So yeah, I'm going to possibly have boobs soon. I'm really excited about it. I told one of my friends, he said that a B cup would not really be worth going through the trauma, but any size I get, any size that he recommends, I'm gonna get it. Like, if it's bigger than what I have, I don't care. Um, I want bigger boobs. It doesn't matter. Size does not matter, boob-wise to me. So, yes. Sorry. I am so excited and I rambled so much, but it's finally in the works and it's taken not as long as I thought because my doctor said it would take a year. So I don't know what the hell happened and why it's not taking a year because I know a lot of trans girls like me are on a waiting list like for a long time to get this surgery and I'm not. It's like I'm ahead of them, which makes no sense at all. But I guess that's something. Anyways, I'll talk to you guys later. Thumbs up, subscribe. You really don't have to, but I'd really appreciate it. And I will definitely talk to you guys soon. Bye.